This is MM668 Unit 10 Journal. My first question I need to address is what goals did you set for yourself in the beginning of the semester, and did you meet these goals? My goal was to continue learning as much about psychiatric medicine as I could. And this semester was like awesome because I mostly had adults. I mostly got to see a ton of diagnosis from like almost like 17 to like 76, I think. So I got a great span of the entire adult population. I got to see sleeping disorders in older patients. I got to see some manic patients that come in for bipolar that were on SSRIs. So I think I met my goals. My goal is to continue learning forever. So I don't know if there's one definitive answer, but my goal was to learn as much as I could. I learned a ton of different strategies for implementing medication and incorporating the patient into the treatment plan. I thought that was a great approach. I learned to do the complete psychiatric evaluations to a better degree where I feel a little more comfortable with that. So I felt that was kind of what I was trying to do, was get myself in a preparation to be a provider. I still have a long ways to go, but I feel that I can start with the basics and work from there. My next entry here is: what feelings, prejudice, and bias did you experience during your clinical experience, and how did you manage them? Patience can be my bias. A lot of my bias, I think, sometimes it was children mostly, and the parents of children is one of my biggest bias. When it comes to dealing with children, I have to deal with their parents, and it is so difficult to have a parent try to force a medication on a child when you don't know if the child wants the medication. They don't really have complete say into the medication. That wasn't as experienced that much. How do I handle that? I try to avoid those patients as I can. And when you can avoid them, you really have to be diligent in knowing who your patient is. And the biases, everybody has a bias from time to time, and you just got to do the best to keep them out of your mind, and remember that at the end of the day, all we care about is the actual patient and making their lives better in a positive change. And if we're not doing that, then we probably don't need to be helping that patient. So if you're not making the patient's life better, then you need to reevaluate what your feelings are on those particular biases. I mean, because we're always going to have somebody that we just can't click with personality wise. Just some of their stories that just get tough. So that's that. Let's see. How did you manage your anxiety, self-doubt, and uncertainty? I still get anxiety. I do it by taking I do the deep breaths before I start interview. We always take blood pressure, which actually gives me a chance to like just take a few deep breaths while everybody's really quiet in the room. So that helped with the anxiety part. Self-doubt, I still have that. I don't know. You just feel more comfortable the more you do it, but I still have self-doubt. I think I have the imposter syndrome. I'm still going to probably have the imposter syndrome for a while, because you just second guess yourself because you're trying to, I think you can think too much about it, and sometimes you're like, what would be the best, and you're looking for SSRI profiles, and you're making sure that, is this the best depression medication for this particular patient, or is this the best antipsychotic for this particular patient, or what have we tried in the past, did any of this work? And it just feels like there's a lot of things we're going through, and you're always self-doubting because you're like, I hope that I am doing the best to provide care for this patient, because that's why we got into this field, was we're nurses, we're patient-centered, care-driven individuals, and it's taken me a little bit transitioning from the RN role to the provider role, and there's a big difference between the two. So self-doubt, I'm just, I think just continually educating yourself, and know at the end of the day that you can still look stuff up, you can still use your book, that you don't know all the answers is how I kind of help with my self-doubt and uncertainty about the situation. And I like asking other providers, and just not knowing everything, I think, is the best way, because that keeps you humble, keeps you in a good place, and I think it helps with your patient-centered care the best. What understanding or insight did you develop during your clinical experience? Yeah, there's tons of stuff. I just keep learning. Insights, I think I can pretty much determine, I'm getting better at like bipolar 1 versus bipolar 2. I feel like with the amount of cases that we happen to come in here and seeing patients that were not good, kind of good, doing well, I'm getting more confident in determining the difference between hypomania and mania, and what signs and symptoms I'm looking for. I feel like I don't know if I have good insight into everything, but I feel like that I'm able to read the room a little better. I mean, when I first started clinicals like a year and a half ago, I was like, what is your anxiety level? And now I feel like I'm able to get more information out of what the patient tells me. I don't have to ask as many direct questions. I'm able to decipher like little bits of the anxiety and depression out of what they're telling me, which gives them more time to communicate with me. So I feel like I've been able to work on that as an insight, because I'm not asking what was your sleep at night and how many hours. I still catch myself asking those questions if I'm missing them, but I feel like I'm better able to pick the assessments apart. It's just from practice. That's basically how you get better, and you gotta stick your stupid foot in your mouth. And I think I said, oh, a lady had a baby, and I was like, oh, you have a cute baby girl. Thought it was dressed in girl's clothes, and she's like, it's a baby boy. And I'm like, I'm so sorry. So now I just say, you have a cute baby. I mean, just things like that you just keep learning, that you're like, okay, don't assume, because it makes you look like an idiot. Okay, has reflective practice impacted you as a person, student, and provider? I don't know. Let's see. Reflective practice. I'm assuming just learning more. I just think every day, I just keep coming back to learning more. Reflective practice. I'm not sure what exactly the reflective practice is, except where you think back about your patients, you write about them. And the more I look at patients, I know that when I type up a patient for the week, it's good for me and my brain to go back through this. I just keep learning how the patient-centered care works. Will you continue to use reflection in your future practice? I think so. I think I'm always going to look back at cases and see how things are going. I think that's how you learn, because not just old cases, but how you are as a provider and how you've grown. Because if you can't see where you were, you don't know where you're going. So it is a good starting point for me, but I don't have all the answers. And I think once I get done with my board tests, I will look back at like the first day of my job and see how I do compared to a year from then, and I'll be like, dramatically different. I know that it just comes down to time and getting the hours, getting the patients seen, getting those failures out of the way, so you can, the sooner you fail, the easier it gets to learn from your mistakes. And that's what I'm hoping I can do. So that's my journal for this class. I really enjoyed this class. This was like finally like the best. It was like the culmination. I know everybody says that, but this was like the best semester because I got to focus on the patients I care about. I got to do outpatient where I was like very comfortable. I got to work with a great preceptor. I mean, everything just kind of came together. It was just tough getting all my hours in this year because of the way things went, but I really had a great time and I learned a lot. So thank you for having this awesome class. I'm going to upload my last journal and hopefully I can come back to YouTube a year from now and watch this and be like, wow, was that me a year ago? So I hope that I can do that. Maybe you should send these out to us in a year. That would be kind of a cool thing and be like, this is where you were a year ago. What do you think? How do you think you are now? So it's Travis Pearson from my last journal. Thank you very much. Bye.